So I appreciate everybody's attention, and I'm going to try and make this interactive as much as possible. So good morning. Again, I'm Ronnie Mason, Fire Inspector for City of Burlington. And today I wanted to talk to you guys about using Epi-Pen AutoInjector. So a couple of you have already raised your hands if you know somebody who has one. Does anybody know anyone in the school who carries one? So we've got 2 people that know. There are actually 15 people in the school that the school nurse is aware of that carry an Epi-Pen every day. So it's very likely one of you might have to use one of these. Has anybody seen one before? So they kind of look like this. Usually it's in a plastic case, and somebody will have them in their backpack. Troy, where do they keep them in their backpack?
If a person has an allergy and it's in their backpack, our school rule is front part of the backpack, in the front pocket of the backpack, right-hand side. Teachers all know who carries EpiPens in school.
Perfect. So that way, if you have a friend that's having an allergic reaction and they happen to have an EpiPen, you'll be able to find it. So a few things we're going to talk about today. I'm going to give you some information in the lecture, and you should be able to describe what an allergy is and how to administer an EpiPen. So, has anybody heard of anaphylaxis? So, a few of you. Anybody know what it is? Can somebody give me a definition? Nobody. All right. Easy way to describe it, it's an extreme life-threatening allergic reaction. One thing about anaphylaxis, it does have to involve 2 systems of your body. So, typically respiratory or your skin. It can also involve other organ systems, your heart, blood vessels, lungs, all of that. So anaphylaxis will get at least 2 of those systems. Here's some common signs. Urticaria, that's hives, that's what you're seeing in the top picture here. That is a typical allergic reaction you'll find from somebody if they have, say, even poison ivy, you can get that. Anybody who has nut allergies, anything like that can get hives. Egg allergies. So, Cooper, for your eggs Thursday, might want to check and make sure nobody has any allergies to eggs beforehand.
I'm just going to go on record again. If anybody gets sick, it's Cooper's fault.
So you're going to have small areas, generalized itching or burning, appears as multiple small raised areas on the skin. Now the next one is angioedema. So this is another skin condition, but what will happen is parts of your body will swell up, such as you see as this woman's tongue here. Her tongue's swelling up so much, her airway is completely closed. It's going to be a little hard to breathe, right? So in that, your airway can also close up and make it real tight and constricted. And that will cause something we call wheezing. That is a high-pitched whistling breath when you're exhaling. So that wheezing is indicative of upper airway obstruction. So if you're choking on something or if your airway's closed up, a lot of times you'll hear that wheezing. And here we have a video of what that sounds like. So you hear him breathing in. On the exhale, kind of has that whistle to it. I think somebody said earlier it sounds like whales talking. It can be high or low pitched depending on where the obstruction is or how tight the constriction is. Any questions on that? Perfect. So for general emergency care, if you come across somebody that is in anaphylaxis, having issues breathing, you're hearing the wheezing, you're seeing swelling or rashes or anything on their body. So you want to administer what's called BLS, that's basic life support. So you want to provide prompt transport to the hospital. Obviously you guys would not be doing that. If there is a stinger present, do not use tweezers to try and pull it out. If somebody has an ID card, credit card or something, you can scrape it, that will help pull it out. and keep it from putting more poison into the skin. So if somebody's stung by a bee, you can do that. So what's the first thing you want to do if somebody has an allergic reaction? Anybody? Call 911. That way it can get us here as soon as possible. So these are some general care areas. You want to wash the area with soap or antiseptic. Remove any jewelry from the area. Why would we want to remove jewelry? If you have a ring on your finger, you get stung in your hand starts swelling. Are you going to be able to get that ring off? No, because that swelling is going to get tight on that ring, and eventually if it swells too much, you'll cut off blood flow to that finger. Same with bracelets. You want to take those off. If they have any necklaces that are kind of tight around the neck, real loose ones, wouldn't have to worry that much about. But if there's any swelling at all, that can cause restrictions and cause a loss of blood flow. Let's see. Position the injection site below the heart. So what that means, if, say I got stung on my hand, you don't want to keep their hand up high. You want to put it low, below the level of their heart. So that way any of the poisons that are in there, they don't have free flow to go throughout your system. You want to apply ice packs or cold packs, and then be alert for signs of airway swelling or other signs of anaphylaxis. You want to place the patient in supine position, which is laying down, and then give oxygen as needed. Obviously, you guys are not going to be giving oxygen. Most of this slide was made for basic EMTs and emergency responders. So there might be some things you won't be doing here. So the main thing is you want to listen for airway breathing, airway restrictions. If they start showing signs of swelling, that's when we're going to be giving the Epi-Pen. And if they are having trouble breathing, sit them up and make sure they're upright. Because most of the time if you're laying down or on your side, it makes it harder to breathe. So if they're having trouble breathing, make sure and sit them up. So using an auto-injector. How many of you heard of epinephrine? So epinephrine is a chemical that our body actually makes on its own, and it mimics the sympathetic response system in your body, which is the fight or flight. So anytime your body, if it goes into shock or other, if you get into situations where you need to run or do something, your body's going to automatically send epinephrine throughout. Sometimes, in cases of anaphylaxis, your body can't send enough epinephrine out, and it's going to do the opposite and constrict stuff. So your airway will constrict, blood vessels can constrict, causing a lack of blood flow. So that's when we need to give more epinephrine. It reverses vasodilation and hypotension. Vasodilation is that constriction of your blood vessels, and hypotension is slow heart rate. So your body's naturally going to want to shut all that stuff down because it wants that poison, that allergen, to not flow throughout the body so it doesn't damage other portions of your body. Increases your cardiac contractility, which makes your heart beat faster, and it relieves bronchospasms. Bronchospasms can happen in your bronchial tubes, in your lungs, and that's what your bronchioles are what transport the oxygen to your blood. So you want to make sure those are all opened up so that way oxygen can get to your blood. If you don't have oxygen in your blood, you're going to survive long? No, your brain kind of needs that. I know early in the morning my brain seems to be low on it. So it rapidly reverses the effects of anaphylaxis. Epinephrine is prescribed by a physician and comes pre-dosed in an injector, like you see here, or the one you see on the screen here. And it will come in a plastic case, usually 2 at a time. And EMS service may or may not allow you to assist the patient in the administration of epinephrine. If we are not here and they need it, we recommend you give it. So adult epinephrine delivers 0.3 milligrams of epinephrine, and the child system delivers 0.15. So a child will get half the dose of an adult. This really doesn't matter for you guys because you have one pen. That's the one you're going to be using. And, so to use the auto-injector, it has a safety cap on the top. You can see this blue cap on the top. You want to take that off. If you have some type of antiseptic that you can wipe them down with, that's good. If not, we're going to apply it anyway. So you want to place the tip of the auto-injector against the lateral part of the thigh. So the thigh, you want to get the fatty part of the thigh. You don't want to go on the top because it's possible it could hit the bone. Don't want to do that. We want to stay where the muscle tissue is. And you're going to push it firmly against the thigh until you hear a click, like that. And then you need to hold it in place for 10 seconds. That way it gives time for the medicine to go in. So it's kind of a slow release. It doesn't do it all at once. So you need to make sure you hold it there for 10 seconds. Can I use this through jeans? Yes, you can. So you can go right through their clothing. You don't have to take their pants off to use the Epi-Pen. So the needle in here is strong enough that it will go through jeans and any kind of clothing. Afterwards, say to rub injection site for 10 seconds. This will just kind of take some of the pain away from the injection site for the patient. And if you can, record the time and let the EMS know when they get here what time you gave the Epi-Pen. And mainly for EMS, we'll reassess and record the patient's vitals and check their heart rate and blood pressure and lung sounds, everything, make sure they're good. It is possible to get side effects. So a big dose of epinephrine can cause headaches, it can cause dizziness, chest pain, nausea, vomiting, anxiety, increased heart rate. But all these things are better than not being able to breathe, right? Alright, so quick review. Who knows the definition of anaphylaxis now? Few people? Somebody tell me?
It's the extreme allergic reaction that your body makes to something.
Perfect. So when using the Epi-Pen auto-injector, which side goes to the thigh? Orange or blue?
Orange.
Orange. Perfect. How long do you hold it onto the thigh?
10 seconds.
Alright. Do you want to go in the top of the thigh? You want to go in the knee? No. We're going to go in the side of the thigh, right? So you push it till you hear that click. You don't have to push it too hard. And you're ready to go on it. So, let's see. That is all I have for that. I'm going to turn some lights on. And let's see. I'm going to get 2 volunteers. Alright guys, come on up. One other thing real quick. When you are giving this, you're going to hold it like this. Do not put your thumb over the top. And never put a finger or anything over the orange part. Because if the needle goes into a finger, you can cause serious damage to your fingers because that much epinephrine in one localized spot like that doesn't get much blood flow. You can cause nerve damage and some other things. So that's why you always want to get it into muscle tissue. But just make sure you always hold it in a fist like this. Never put your thumb over the top because that could prevent the needle from coming out. And never put it over the bottom. So I'm going to give that to you guys. Alright, and let's see. Actually, you know what, let me see this one. So you're going to administer it to him. Let's put, here, I'll have you sit right here on the stool. Excuse me. We'll sit right next to Trey. Alright, so you come across your friend at lunch, and he's having trouble breathing, and you can see his lips are swelling up, and he hands you his Epi-Pen. So, what are you going to do with it?
Well, first I'm gonna assess the situation. He's not doing alright, so I'm gonna go.
Right.
I gotta stab right here.
Okay, are you going to do it just like that?
First, I gotta take the cap off, and then I
Yep.
stab him right here. Then I rub it.
Well, go ahead and do it. 'Cause you got to hold it there too, right?
Yeah, hold it here just like that.
Well, no, push until it clicks. You got to do it.
Well, actually,
Yeah, there's no needle in it. And then you hold it for 10 seconds.
he's dead now.
Oh, the needle's already retracted.
Dude, you killed me.
Try again.
Alright.
Let's see if we can do this again.
Alright.
Alright, so what are your steps?
My steps, he's dying right now, so.
Okay.
So I'm like, oh no. So I take my cap off. 1, 2, 3, 4, 5.
6 is after 5.
Feeling alright, man?
Oh yeah.
And
Now,
then when they come, I'm like 7:40.
perfect. So he noted the time that he gave it. And let's see. Alright, now it's your turn to be the patient.
Don't kill me. Alright, leave me.
So we're outside, we're in the football field.
Alright.
He just got stung by a bee. Throat's swelling up really bad.
Okay. Heavier Epi-Pen. Got a heavier Epi-Pen. Heavier Epi-Pen.
There you go, man.
I got this.
Well, once you put it in, you want to make sure you hold it in the same spot. You don't want to drag the needle around his leg.
Hey, can I rub it?
We'll do another one.
I think I need to die. Alright. 7. Oh. Oh no, Gavin, are you okay?
No, I got stuck.
Oh no.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yeah.
And the time was 7:41.
Perfect. Now, what are you going to do with the used needle?
I'll put in the.
Yes, you want to give it to the paramedics when they arrive. So, thank you guys. You can do it. So, another thing with epinephrine, it's not going to last
No
long in your
claws.
system. It usually lasts about 5 to 10